Now, all around the world, COVID-19 has carried an added tragedy along with its symptoms. Because of how infectious the virus is, even after death, terminal patients often die separated from family and relatives. And, the relatives themselves are denied a proper goodbye. So the Sheba Medical Center has come up with a solution. It's a specialized glass chamber. And joining us with more is Sheba Medical Center's international spokesperson, Steve Walz. So before we start talking about the chamber that you set up, can you tell us a little bit about how many coronavirus patients are currently being hospitalized and what their condition is?
Yes, as of this morning, we had 93 patients. Most of them were in good or moderate condition, but we have also 35 who were in critical condition. Some of them have been hooked up to ventilators. What we're seeing is a lowering of the number of mild cases because they're going to other locations like hotels, whatever. But we are seeing a slow spike in the number of those who need critical care because we are in proximity to places like Bnei Brak and also nursing homes nearby. So we will see a slight spike in the number of critical injured people.
Now, do you have enough respirators for patients that are in critical condition?
Everybody keeps asking us the same question. This is Sheba Medical Center. We are well prepared. We were well prepared even before the first coronavirus patient arrived here from the Diamond Princess ship. We are well prepared and we have enough respirators for now.
So let's talk a little bit about this glass chamber. How has it been built? How does it protect the health of grieving families? What is it?
It's a simple glass chamber that actually is used when a person passes away in our critical care unit, which is underground. They are put in this glass encased, it's a glass encased area, and it's rolled on a gurney to an area that is, we created a two-way mirror so that families could see their loved ones for the last time without actually entering the critical care corona unit, which is quite dangerous because there are critically ill corona people in there, but it gives them a sense of closure. They can spend 5 minutes looking behind the glass enclosed area and a curtain, say whatever prayers they need to say, or at least have closure with their loved ones.
Well, I imagine that you've had to make a lot of other changes to the hospital as well to deal with the situations. What trends do you predict following the Passover holiday in terms of infection rates and deaths?
So the hospital, as you know, as the National Hospital of Israel, we were the first hospital asked by the Ministry of Health and the government to prepare because we have the most space of any hospital in Israel. We have 220 acres. And even as we speak, another critical care corona unit is being prepared underground in another part of the hospital that will be operational already next week, that will house another 150 to 180 critically ill corona patients, which would give us over 200 beds, literally over 200 beds for critical care unit and almost 500 beds total for all corona care units.
So it seems, I mean, from what you're saying, that we're going to see these numbers growing, that this isn't going to be slowing down anytime soon.
Well, we expect corona to be with us for a while. We do not expect a hard raise in the numbers, but as I mentioned earlier, we did see a small spike in critical care corona patients. We expect that to continue, but we do not expect to see a huge spike in general because of now the government, allocating small hotels for others for mild cases. We want to deal with the cases that are moderate to those who need critical care.
Okay. All right. Well, Doctor, thank you so much for joining us with this update. And, again, kudos to you for all the hard work that you're doing. You guys are really at the front line of this disease.